Every year, HIV-related illnesses claim the lives of about 630,000 people around the world. And here in Belize, more than 3,700 people are living with the virus. For them, access to life-saving treatment isn't just important, it's everything. But now, that access is under threat. Since the U.S. pulled its funding for HIV care in the Caribbean, the safety net that many relied on is starting to unravel. Kimberly Simpson has been living with HIV for nearly 17 years. She says the funding cuts are more than just numbers on a page. They're a frightening glimpse into a future where people like her may no longer get the care they need to survive.
That's our life you're talking about, you know. Without our ARVs, eventually your system will drop back, you know. The HIV will eventually turn into AIDS because you're not on treatment. And like I said, it will also put a toll on you mentally, because then you know what it's like, you know that you won't be able to no longer get your medication, something that you need to survive off. And then imagine if you also have kids. You're not only trying to live for yourself, but you're trying to live for your kids and your loved ones who is a part of your life also.
New data is raising red flags in the fight against HIV in Belize. According to the chair of the National AIDS Commission, only 80% of people living with HIV know their status, and of that group, just half are receiving the antiretroviral treatment that they need to manage the virus. A recent survey by UNAIDS and PANCAP reveals that disruptions to HIV prevention and testing services are widespread across the region. These services are critical to keeping the virus under control and moving closer to the goal of ending AIDS.
The Global Fund to fight HIV and tuberculosis, with mostly HIV, gets 1/3 of its funding from the United States. Now, if they are about to cut that funding, it's going to significantly affect the Global Fund's reaction to the HIV struggle throughout the Caribbean. And I can tell you that here in Belize, although we have made some progress, we absolutely are not where we want to be.
According to the UN, 80% of HIV care organizations are now facing significant reductions in services, a development that could have far-reaching consequences for those relying on the consistent medical support. The situation extends beyond healthcare. Social protection services, which provide vital support for the vulnerable populations, have experienced a 75% disruption. Meanwhile, 67% of human rights groups have also been affected, raising concerns about the broader impact of civil liberties and advocacy efforts. Kendall Trapp, Executive Director of the Empower Yourself Belize movement, acknowledged the challenges, but emphasized his organization's core services remain intact. However, he stressed that access to medication remains critical to the overall care of individuals living with HIV.
The most important part is bringing them to the realization or accepting that I am HIV positive, and the ARV that the Ministry of Health is providing can save your life, and that having an HIV diagnosis is not the end of the world.
For 20 years, Belizeans have received free HIV medication thanks to the support of the Global Fund. But now, with 1/3 of that funding cut, the government is figuring out how to keep this critical care going. The silver lining, a backup plan has been in the works. Since the Global Fund reviews its support every year, Belize knew this day might come and has been preparing for the possibility of losing the grant entirely.
The National AIDS Commission, along with the Ministry of Health, we have put up a cabinet paper, and basically what we're saying in that paper is we're asking for all hands to come back on deck. Because we have still a serious situation on our hands, and we need everybody to cooperate. Asking, of course, for the cooperation of key ministries, education, human development, and especially the Ministry of Health, and then, of course, our community service organizations and NGOs.
Living with HIV comes with its challenges. from social discrimination to the physical toll on the body. Kimberly hopes that a financial burden does not become an additional stress.
Imagine I'm already there, early in the morning, tired, sometimes hungry because then you have to wait to go and do tests or whatever like that, and then it's a bit stressful. You get frustrated. Sometimes I find myself even wanting to give up. Like, I should just go home and just leave it at that. But then when I think about how far I've come, I just try to gather the strength to get that patient, but not everyone is like me.
Regional leaders need to step up now before we see a rise in HIV deaths or new infections. These treatment centers aren't just clinics. They're the heart of the fight against HIV. Without them, the entire response system starts to fall apart.
We did bring to the attention of the Prime Minister and Cabinet that where the funding may reduce or dry up from the Global Fund, countries will have to step up and fill that gap. And like I said, a third of the funding of the Global Fund comes from the United States. So we have to be prepared in all our Caribbean countries, not just Belize. We have to be prepared now to step up and fill the gap, the funding gap that is likely to happen.
The U.S. pulling back its support from the Global Fund has left a huge gap, and it's one we simply cannot afford to ignore. If we don't act fast, we risk losing decades of hard-won progress in reducing HIV-related deaths and slowing the spread of the virus across the region. Britney Gordon for News 5.